Well, now to a story that has a lot of people talking today. The first human case of the Zika virus detected right here in Indiana. Then Ann Kelly talked with the State Department of Health today and explained what this means for us.
Well, Candace, the State Department of Health saying, yes, there has been a case of Zika here in Indiana, but stressing over and over, we really don't need to be concerned that the chance of contracting it, if you stay here in Indiana, is extremely low. Now, before I get to why it is so low, let's touch on what we've learned about the person who contracted it, the Hoosier who did contract Zika, and what the State Department of Health was able to tell us about him or her.
This patient had a mild illness that did not require hospitalization and has since made a full recovery. The patient did have a travel history to Haiti, which is an area where we know that there's documented Zika virus transmission occurring. And this patient was not a pregnant woman, so there was no concern for exposure to a developing fetus.
So an important takeaway there, the patient caught the Zika virus in Haiti. Now back to why the risk of catching the mosquito-borne virus is low in Indiana. The State Department of Health saying today, even if a number of people traveled abroad and brought it back here, the fact remains that just 2 types of mosquitoes can spread the virus. Indiana only has 1 of them, and it can only be found in the southern 2/3 of the state. Also, Zika can only stay alive for the long term in wild, non-human primates, something we simply don't have in Indiana. And again, Candace, the state's stressing that if you stay in Indiana, you really are not at risk for catching this. Of course, we know, though, people are traveling to the affected areas, and because of that, actually a blood center here in Indiana now with new restrictions in order to keep you safe. We'll make sure to touch on those at 4:30.
Excellent, Ann Kelly. Thanks so much. A developing story will continue to follow, definitely. Now, our neighbor to the east is also dealing with its first case of the Zika virus. The Ohio State Department of Health says a 30-year-old Cleveland woman has it after returning from travel in Haiti. The state says planning is underway for a Zika virus tabletop exercise to make sure Ohio is prepared to handle the 2016 mosquito season. And so far, no one has gotten the virus from mosquitoes here in the U.S., but there are concerns that could happen later this year. So the CDC just moved its emergency operations center to the highest level in order to prepare. The only other time a level 1 activation has happened are with Ebola, H1N1 in 2009, and after Hurricane Katrina.